Hello everyone, this is Patel. I'm a board certified family physician at Trappman Family Medicine. This is primarily for physicians who are primary care physicians who are interested in aesthetic medicine and cosmetic medicine. I want to talk about how to do a facial assessment prior to doing any cosmetic treatment. And it's very important you understand the concept of what beauty means. Beauty, understanding what it means and how it's defined and what it means in the context of a patient who's seeking treatment is vitally important in order to optimize results and get the best rejuvenation for the patient. So, this is Nadine here, who's kindly volunteered to be our model to demonstrate some of the concepts. Now, female beauty is very different from male beauty. And when we look at female beauty, the generally accepted concept in developed societies is that a wide, large forehead, which looks beautiful in women, V-shaped face, smooth lines, pores being small, make sure there's the volume, the flatness or volumes of the cheeks, high arched brows, narrow, generally narrow, the distance between the eyes is narrower. These are the generally accepted concept of beauty, and our whole purpose of rejuvenation is to try and optimize those things that we can. I will mostly be talking about sort of non-surgical techniques here, as this is the area of my expertise. So in terms of the aging, one has to also understand what aging is. Aging means many different things. It's intrinsic and extrinsic. The intrinsic, by that what I mean is that as one gets older, the elastic tissue disappears, the elastin in the face, collagen is reduced, the fat pads deteriorate and is reduced in the face, so the cheeks become more hollow. Generally, the face goes from a sort of round, full appearance, deflates, it goes southwards. Wrinkles appear, lines appear, fine lines, coarse lines, the muscles which become active, create lines, particularly in the glabella, the forehead area. The lips deteriorate, they lose their shape, and what we're trying to do in our cosmetic aesthetic evaluation is to sort of identify what these areas are and also find out what the patient's expectation is. It's very important that you are in cue with what the patient expects. They may come in for little lines which they just filled in, for example nasolabial lines and parentheses, but in fact it's very important to take a global view of facial rejuvenation, and in particular looking at sort of all the modalities that are available, from sort of muscle relaxants, for example neuromodulators like Botox and Dysport and Xeomin, to fillers, which is a whole range of them, from Restylane to Juvederm, Radius and the longer acting fillers, laser treatments, skin peels, skin pen treatments, and then the surgical options. Once you have a full appreciation of all these modalities available, you can discuss that with the patient and come up with an optimal plan and a pathway, a chart, a journey of what they would like in order to improve their facial aesthetics. So in this case, Nadine here, it's important to ask the question, what is it that bothers her? And we've had this consultation prior to this meeting, and she would like the glabella lines, which is this group here, the procerius and the corrugator striatus. When she gets mad and upset, there's lines showing, and she sees the 11th sign, which is what we call that. Look up for me, Nadine, and she gets these forehead lines, which we noticed before, and she would like those relaxed a little bit. And then the crow's feet. Close your eyes and screw your eyes up tight. She's pretty good. She doesn't have mild crow's feet lines, but these have been treated in the past, and I think she's kind of due for some. She's also would like her parentheses, which is the nasolabial folds, treated here. She has requested also cheeks. She's had this several times in the past, the cheeks augmentation just to lift, and these are very important in the mid-face here to sort of fill this area up and lift. Rather than sometimes just treat the nasolabials, it's important to fill this, and this will automatically lift it. The lip shape is great. She's got nice pillars there, the philtrum there. She's got a nice cupid bow there, and the vermilion borders nicely sort of delineated there. And that we've done a few months ago now. The corners of the mouth are nicely lifted up here, but we can also put Botox in the DAO muscle there, the depressor angularis oris muscle, which will lift slightly, and some fillers here to form support there. This is the marionette area. Again, this has been filled, so she looks pretty good. She's also got quite a prominent chin. She tightened the chin up. a puckered appearance there, and that lends itself very nicely to neuromodulators such as Botox and Dysport in relaxing this. Other areas where we use Botox is sometimes under the nose here, just to lift the nose up slightly, and a slightly lifted up nose here, the nasalis muscle. Wonderful aesthetic sort of look to it. In her case, she doesn't have a gummy smile. She only see her teeth, and sometimes just giving some Botox in this area here, the retin-a muscle can actually relax this muscle and to stop that gummy smile. But these are advanced techniques, and it's very important to understand the anatomy and the physiology and all the nerve supply and arterial supply, and also warn patients you're going to be doing this because their mouth will not function like it used to, and they may not be able to make the P's and O's, which may be a problem to some players, but some patients, particularly those involved in playing instruments and that. Other areas which we can fill are certainly the jowl lines, and hers, we've worked on this before, and to smoothen this line out here and here as well. Another area which is now done very commonly is the nasojugular groove here, a line here, so they get bags under the eyes, and these lends itself for fillers very nicely. A slightly deeper injection underneath the orbicularis oris muscle, on just above the periosteum. But these are advanced techniques, and one has to be very careful and understand how fillers work and be experienced with fillers generally before moving on to this area. The temporal recess here can also be filled up with using fillers. That's just an overview of some of the techniques, an assessment, and some of the modalities for neuromodulators and fillers that's available to us. Thank you.